Hello class, this is Ofelia. I'm using my microphone today. We're gonna see whether the quality is better. And that's so today we're gonna be talking about discussion for group discussion for week number 6. So the first question, as a therapist, how may you engage your client in working towards enhance sexual experience even within their home or limit abilities following one or more of the above challenges? I was a little bit confused in regards to the question when they say limited abilities. And I was wondering if that refers to physically, intellectually, psychological, or emotional. So where were those limitations? So I just moved forward and assume it was physical ability. So please, as you watch this video, please correct me if I am wrong, or just give me your opinion in regards to what is it that you answer to this question. So first and foremost, I believe that it is important for the individual to identify exactly what is the physical problem. In this case, if it is psychological or intellectual, so identify that problem and then talk to their doctor about what are the possible limitations or what are the recommended care or what are the expectations of the treatment while you're in the treatment and after the treatment. One example is erectile dysfunction or dry libido. And then from there, the client and the therapist can somehow brainstorm in how to get the best out of them within the norms of the situation or whatever situation they are experiencing. In the clinical sexuality for mental health professionals book, page 361, Levine lists a series of recommendations to conduct an assessment and help the client overcome a possible psychological, intellectual, emotional, and maybe even physical challenge. The first step, which he suggests, is to obtain as much collateral information as possible. That might be with the medical doctor, with the psychiatric, or any other mental health professional that is involved in the treatment of this individual. And the idea is to rule out disorders that can masquerade as personality disorders or identify comorbid disorders such as substance abuse. So we know that they are not playing a big role in the treatment. The next step is to review the findings with the individual seeking treatment so the individual is well aware of what is the situation and what are the limitations. Provide psychotherapy as a couple if this person has a partner, maybe bring their partner to participate in therapy. So together can identify any feelings, thoughts, or behavior that might be affecting the sexual relationship in somehow negatively. Identify the risks and the benefits of pharmacotherapy should be reviewed. In this case, if the client or the individual is taking any pharma, we also need to identify how pharma is interacting or what are the side effects of the pharma, and if the if the drugs are actually affecting the client's or the individual's sexual drive. We also suggest techniques for talking calmly about both partners' wish to reassume a sexual life and for ensuring that they are prepared emotionally somehow. For instance, if you invite the two individuals as a couple, it is important for them to openly share about their thoughts of what is going on, what is their expectations, and how can somehow become, supportive of each other. The therapist may also need to address one or both partners' depression, since this one tends to perform or experience some triggers anxiety as well, or inquire about any physical obstacles such as vaginal dryness, which I did mention before, which can be diminishing the quality of their sexual experience. And also therapists must speak realistically about the treatment as well as provide guidance about how to best use the pharmacological intervention if that's the case. However, the goal for every patient should be the establishment of lawful, happy, fulfilling sex life within the context of meaningful and balanced lifestyle, quoted by the book by Levine, which is on page 361. Okay, something that I do remember, I had it on the book, I read it in the book, and I thought that was very cool. What they said is Levine stated that success required that the therapist help the individual. Success required that the therapist help the individual or the couple to overcome a variety of social barriers to lovemaking. That includes that the individual psychology, emotionally, and what are those three areas of the persona? You know, the psychological, the intellectual, and the emotional part of the individual has to be, the individual has to be aware of the levels of intellectual levels of psychological and emotional levels in order to identify what could be the limitations, as well as the therapist identify those barriers that could be interfering in the relationship of the lovemaking. Question number 2, why is enhanced sexual interaction important to an individual following such an event? It is important to enhance sexual interaction in the individual who may have medical intervention in order to decrease tension and uncertainty within the relationship. For example, as we see in page 363 of the book, we see the case of Rob dysfunction, in which after a long history of treatment, his doctor suggests that the etiology of his dysfunction was psychogenic. But that means it was not only genetically or biologically, but it was also psychologically. So the doctor, in fact, had identified that Rob had lost his sexual confidence and also developed an intense performance anxiety. He discovered that he did not become sexually aroused because he was too busy watching and worrying about his erectile performance. So he was so focused and so concentrated having an erection that he pretty much lost focus of what other factors play within the sexual relationship, the intimacy of the erection, right? So this doctor recommended that he, that when taking the drug of the medication that he was taking, that he should focus and senses feelings, which means mental and physically. Quote, so parenthesis, the sensation of touching and being touched. So in other words, doctor recommend Rob to, as soon as he takes the medication, to start focusing and, and the feelings and physically thinking about maybe even feeling that he was being touched by his partner and, and feeling the touch. So it is like triggering or activating your imagination. So the moment that you activate your imagination, that contributed for Rob to be able to have an ejaculation as as he desired. And the doctor encouraged him to try to avoid negative, fearful thoughts about losing his erection and watching his performance. So his performance, due to the fact that his performance triggered anxiety and diminished, the target goal, which was him having an ejaculation. So the therapist was to restore Rob's confidence and to win him from sliding after he truly understands the interpersonal anxiety. Question number 3, how may other areas of the individual's life be enhanced following the exploration of improved sexual experience? To be honest, I try to find information in the book that would give me an answer to this. And even after reading this question several times, I was a little bit confused and not able to probably understand well the question. So if you see that I am misleading the answer, please feel free to redirect me and tell me what exactly do you put in your, how do you answer this question? So how may other areas of the individual's life be enhanced following exploration of improvement sexual experience? I put, and I found, of course, this in one of the articles that I quoted. This is by Perrin and his team. I Want Your Sex. The name of the title is I Want Your Sex, the role of sexual exploration and fostering positive sexual concepts for heterosexual and sexual minority women. So according to the results, he stated that enhancing individual sexual experience, by enhancing individual sexual experience, individuals become more confident, less anxious, and less depressed. So if we think about the mind and body connections, it seems like the body will respond accordingly to whatever is going on in the mind. So even if the body wants to respond positively in regards to their sex drive, if the mind is not there, that is going to be difficulties in enhancing the exploration of improving the sexual experience. So according to Perrin in his article, I Want Your Sex, positive psychology suggests that openness to experience could prove to be an important resilience factor for sexual orientation minority persons. So what they are suggesting is that the person has to be open to experience and open to find new ways and finding satisfaction. And also the book states that successful sexuality outcomes require attending to the complex interplay between the biological, psychological, and relational components of the individual and couple's life. It is not solely how many orgasms individuals achieve, it is their satisfaction and sense of psychological and relational well-being that constitute success. So how can they experience success in their sexual experiences? By ensuring that psychologically, that the mind, pretty much, that the mind and the body is aligned. Okay, so thank you again. Any feedback is welcome, and recommendations and how and you understanding what you put in regards to what I put is very welcome. Thank you.